Welcome to the Deep Dive, where we slice through complex info, distill it, and help you unlock some, well, surprising insights. Today, we're diving deep into something that honestly affects way more of our equine friends than most people realize: equine periodontal disease. We've pulled together some really excellent sources for this, detailed veterinary research, clinical observations, the whole picture. Our mission here is to equip you with a solid understanding of this really pervasive oral health issue in horses. We'll get into its sneaky origins, the signs that often get missed, and how it's diagnosed and treated. Think of it as your guide to why proactive dental care isn't just routine, it's absolutely critical.
It really is. It's a condition that can seriously impact a horse's comfort, their performance, just their overall quality of life.
Hmm.
And what's, fascinating and frankly frustrating sometimes is how incredibly common it is, but how often those early signs just get overlooked or maybe misinterpreted. Understanding the details here, it can genuinely be a game changer for any horse owner. So yeah, let's unpack this.
Okay, let's start broad. We know about gum disease in people, but what makes equine periodontal disease, PD, uniquely challenging in horses? What's different about them?
Yeah, that's a great place to start because equine teeth are, well, they're quite different. At its core, PD in horses is this inflammatory infectious thing that attacks the structures holding the teeth in place. So we're talking the periodontal ligament that anchors the tooth, the gums or gingiva, the jawbone around the tooth, the alveolar bone, and even the cementum on the root. It basically breaks down these supporting tissues.
And why horses specifically? What makes them prone to this breakdown?
Well, a big part of it is their teeth. They have hypsodont teeth.
Hypsodont, meaning they keep growing.
Exactly. They erupt continuously throughout their lives, wearing down as they chew. And their chewing motion isn't just up and down, it's this unique circular grinding. These factors, plus just common anatomical quirks, sometimes genetics too, they really set the stage for wear and tear. And unfortunately for food, getting trapped where it shouldn't.
Right, so the way their teeth are built and how they chew, and this trapped food, where does that usually happen?
The most common starting point, the thing that kicks it off, is usually food getting packed into abnormal gaps between their cheek teeth. We call these areas diastomata.
Diastomata. Okay, I've heard that term. Are these just natural spaces or?
No, they're abnormal gaps. They can happen for various reasons, maybe an extra tooth or one that's rotated or out of place. Sometimes it's just spaces widening as the horse gets older. We generally talk about two main types. Valve diastomata, they're tighter at the top, the chewing surface, but open up deeper down.
Okay.
And then open diastomata, which are wider right at the chewing surface.
And does one type cause more trouble?
Yeah, the valve type, those are usually linked to more severe PD, probably because food gets wedged in there really tightly, almost like a plunger, and can't get out easily.
It makes total sense. So food gets packed in, but how does just trapped food cause so much damage? What's the actual mechanism?
Okay, so once that food is trapped, it changes the environment in that little space.
Yeah.
It becomes low oxygen or anaerobic.
Yeah.
And that environment is perfect for certain kinds of bacteria to just explode in number. Things like Prevotella or Veillonella.
The bad guys move in.
Exactly. And these bacteria ferment the food, producing toxins and enzymes as byproducts. Those are what irritate and inflame the gums. That's gingivitis, the initial inflammation. And this chronic inflammation, that's where the real problem starts spiraling. It makes the gums recede, pull away from the tooth, and that forms a periodontal pocket.
Like a little cave around the tooth.
Precisely. A perfect little cave for trapping even more food and bacteria. You see the cycle.
Yeah, it feeds itself.
It really does. And as it keeps going, the infection literally destroys that vital periodontal ligament and eats away at the jawbone holding the tooth. The tooth gets looser, it becomes painful. In the worst case scenarios, that infection can track right down to the root. You can get abscesses, even root death, which is incredibly painful for the horse.
Wow. So it's not just the food, it's the whole bacterial cascade that follows. What else can make a horse more likely to get this besides those gaps?
Abnormal dental wear is a huge one. Things like a stip mouth or wave mouth where the teeth don't meet evenly.
Right, uneven wear patterns.
Yeah, or missing teeth hooks, ramps, anything that throws off the normal chewing forces. That can make teeth separate slightly or just allow food to wedge in easier. We also see it sometimes after jaw fractures or even temporarily in younger horses, maybe 2.5 to 4 years old, if their baby teeth don't shed quite right. It's honestly a really common and significant cause of mouth pain, that awful bad breath, and even affecting their overall health. It happens at all ages, but definitely gets more common and worse in older horses.
Given all that, it really does sound incredibly common. Just how common are we talking? What do the numbers say?
They're pretty startling, actually. The general prevalence is reported around 50%.
50%. Half of all horses.
Half of all horses, potentially. And if you look specifically at horses over 15, that number jumps up to maybe 60%. It's definitely more frequent and often more severe in mature and geriatric horses.
Think about that. Half of all horses, maybe more for the older ones, could be dealing with this pain silently. That's
You're right.
sad.
And the scary part is how easily those early signs can be missed, right?
Yeah. So what are the signs? Are they obvious?
Often not, especially early on. Sometimes, truly, there are no outward signs, and we only find it during a routine dental check. But as it gets worse, you will definitely start seeing signs of oral pain.
Okay, so what are those classic things an owner might actually spot?
Well, related to eating, the classic one is quitting. That's when they drop balls of partially chewed food.
Right, I've seen that.
Or you might notice they're eating much slower than usual, maybe seem to have trouble chewing, mastication, or even swallowing oral dysphagia. They might start preferring softer feeds over hay.
And I guess that bad breath halitosis would be a big clue.
Oh, absolutely. That distinctive, really foul smell from the mouth is very common, often one of the earlier signs you can detect. It's from the bacteria breaking down that trapped food. Other things could be excessive drooling, a reluctance to eat, especially coarse hay, and then unexplained weight loss or just poor body condition.
Beyond eating, what about just general behavior? Any subtle things?
Yeah, definitely. Subtler signs might be things like head shyness, suddenly resenting the bridle or harness, or maybe resistance when being ridden.
Things you might put down to training issues.
Exactly. But they could be pain-related. And in really advanced cases, if the infection spreads into the sinuses, creating an orosinus fistula, a connection between mouth and sinus, you might see nasty, smelly discharge from one nostril, maybe eye discharge, or even facial swelling. Sometimes you can even see or feel a lump on the jaw or draining tract if there's a tooth root abscess.
That's a good reminder. Behavioral changes can be key. Are there other risk factors besides age and those tooth issues? Things related to how we manage them?
Yes, domestic feeding practices can play a role. For example, highly processed feeds might lead to less natural chewing action, maybe less saliva production. Both affect how teeth wear and the mouth's natural defenses. And as horses age, besides just wear and tear, conformational changes can happen, and the way the teeth sit together might become less tight, making impaction easier. Also, systemic things like Cushing's syndrome, which affects the immune system, can make them more susceptible.
Okay, so if an owner sees some of these signs or maybe just wants to be proactive and they call the vet, what's the diagnostic process actually look like? How do you figure out exactly what's going on in there?
Well, diagnosis really needs a very thorough, very systematic look inside the mouth, because lots of different mouth problems can cause similar signs. And almost always, this means the horse needs to be well sedated. You just can't do a proper job otherwise. And you need a full mouth speculum that holds the mouth open safely and a good bright light source.
Sedation seems key. Some owners might worry about that, but it sounds essential.
Oh, absolutely essential. Firstly, safety for the horse and the vet. A horse's mouth is a dangerous place to work. Secondly, accuracy. Without sedation and a speculum, you simply cannot see the back teeth properly or probe the gums gently and effectively. It lets us do a really thorough pain-free assessment. Once they're sedated and the speculum's in, we usually rinse the mouth out first just to see where feed might be impacted before we disturb it. Then the vet uses a dental mirror, like your dentist uses, to look at all surfaces. The cheek side, the tongue side, and really importantly, the spaces between the teeth. We'll palpate the gums, feel for swelling, redness, recession, any signs of pain. Then a special tool, a gingival probe, is used to measure the depth of any periodontal pockets.
Measuring the pockets.
Exactly. Healthy gums have very shallow little grooves, maybe a couple of millimeters. Deeper pockets mean disease. A dental pick helps check if any teeth are loose. Oral endoscopy, using a tiny camera, is also super helpful now. It magnifies everything and helps measure pocket depth accurately, especially way in the back. For older horses, sometimes gently tapping on teeth, a repulse test can help identify sore ones.
So that's the hands-on exam. What about looking deeper, under the gums, at the bone? Imaging.
Imaging is critical, yeah, because so much of the damage is hidden. Oral x-rays are usually the first step. We often take special views like open mouth oblique shots. These can show us if the periodontal ligament space is widened or lost. If there's bone loss around the roots, maybe changes to the roots themselves, like clubbing in severe cases. X-rays can also show fluid lines in the sinuses if infection is spread there.
Okay, so X-rays give a good picture. Is there anything even more detailed for tricky cases?
Yes, for complex situations, computed tomography or CT is really the gold standard.
Ah, the 3D scan.
Right. It gives incredibly detailed cross-sectional images of the teeth and the bone all around them. It's brilliant for finding subtle root abscesses, seeing the true extent of bone damage, and telling different dental problems apart. We often use it before planning surgery. Endoscopy can also help visualize those really far back areas. Basic blood tests, like a CBC, usually aren't that helpful for diagnosing PD itself. They're pretty nonspecific. Interestingly, looking at tissue samples under a microscope often shows gum erosion, ulcers, bacteria. But sometimes the changes to the ligament itself, in milder disease, aren't considered irreversible. Which is really hopeful, right? It suggests that ligament can recover if we catch and treat the problem early enough.
That's a really important point. Early action can potentially reverse some damage. So once you have a diagnosis, what's the treatment plan look like? How do you tackle PD?
Well, the main goals are always to get rid of the infection, reduce the inflammation, manage the pain, and really importantly, stop it from coming back. The actual plan varies a lot depending on how severe it is.
Makes sense. What are the main tools in the toolbox?
A cornerstone of treatment is cleaning out those pockets debridement, getting all that impacted food and debris out. This is often done with high-pressure water and air, kind of like a jet wash, plus dental picks and forceps to physically remove packed material. Initially, this might need doing quite often, maybe every couple of weeks. Then as things improve, maybe every 2-3 months. For those tricky valve diastemata, or where teeth are really tight, odontoplasty is often very effective.
Odontoplasty, that's reshaping the tooth?
Yeah, carefully widening the gap slightly at the chewing surface using a power float. The idea is to allow food to clear out more easily during normal chewing. It's a common procedure and often works really well. Now, for the open diastemata, the ones wider at the top, we might do diastema packing. After cleaning the gap thoroughly, we pack it with a soft dental putty or impression material.
Like a temporary filling.
Exactly. It acts as a barrier, stops food packing back in, and gives the gums underneath a chance to heal. Of course, that packing needs to be replaced periodically.
Okay, so cleaning it out, maybe reshaping, maybe packing. What about addressing those underlying wear problems, like uneven surfaces?
Oh, absolutely critical. You have to address the abnormal wear. Proper floating or crown reduction helps distribute chewing forces evenly and reduces pain. Correcting things like hooks, ramps, or steps is essential for normal function. We also often flush the pockets directly with sterile saline or maybe a mild antiseptic solution like dilute chlorhexidine to help control local infection.
What about medication, pain relief, antibiotics?
Yes, definitely. Pain relief is crucial. NSAIDs, non-steroidal anti-inflammatories like phenylbutazone or flunixin are essential to manage the pain and inflammation. That helps the horse eat comfortably, which aids healing. Systemic antibiotics, given by injection or orally, are usually reserved for more severe cases, deep infections, abscesses, facial swelling. Some vets also use local antibiotics, putting them directly into the periodontal pockets.
And when does extraction come into play? When do you decide a tooth just has to come out?
That's usually reserved for severe cases, where the tooth is very loose, or it's fractured badly, or there's a significant root abscess that just won't clear up. If the tooth can't be saved and is causing ongoing pain and infection, extraction might be the best option.
Is that a major procedure?
It can be. Standing extraction, done under heavy sedation and local anesthetic, is preferred now. There are also minimally invasive techniques for certain situations, like breaking the tooth into segments first, which can be less traumatic than older methods. After extraction, the socket is usually packed to stop food getting in while it heals. And if there was a sinus infection involved, that connection needs cleaning up, and the sinus might need flushing, maybe with antibiotics too.
Makes sense. And diet. How important is that during treatment and for prevention?
Hugely important, both during treatment and for long-term prevention. If a horse has active, painful PD, feeding a soft, easy-to-eat diet is vital. Think soaked hay cubes, pellets, mashes, beet pulp. It minimizes further irritation and helps them get nutrition while they heal.
And for prevention.
For prevention, adequate roughage, good quality hay is key. Chewing long fibers properly promotes that side-to-side jaw movement necessary for even tooth wear. And really, if we pull back, prevention is the best strategy overall. Regular dental checkups, at least once a year, maybe twice for some horses, by an experienced vet or equine dental tech. That's paramount. Starting from a young age. Catching and correcting sharp points, hooks, ramps, any malocclusions early is critical. And owners need to be vigilant. Watch for those subtle changes in eating, any bad breath, any swelling. Those are your warning signs.
Okay, so summing it up, what's the outlook for a horse diagnosed with PD? What's the prognosis generally like?
It's really variable. Generally, we'd say it ranges from good to guarded. It heavily depends on how severe the disease is, how long it's been going on, and exactly which parts of the tooth support are affected. For milder cases, just gingivitis or maybe shallow food trapping, the prognosis is usually good, especially if they respond well to routine dental work, maybe widening those diastomata, cleaning things up. Mild PD in younger horses, maybe related to teeth erupting, can even be reversible sometimes if you catch and fix the underlying cause quickly.
That's encouraging. But what about the more severe chronic cases?
Yeah, for those chronic severe situations with significant bone loss, deep pockets, maybe root abscesses, the prognosis is more guarded. Teeth can often be saved, but it usually requires pretty intensive ongoing management. One study we looked at found that even with severe PD, doing that odontoplasty, widening the gaps, led to permanent remission of signs in about half the cases. Another chunk had temporary remission or partial improvement. But in some advanced cases, extraction is still the only way to truly resolve the disease and make the horse comfortable. If a tooth does need to be extracted, the prognosis for the horse's survival is generally fair. But it can impact their performance career, and they'll likely need dietary adjustments long term. Complications from treatment aren't super common, but they can happen things like a piece of dead bone forming, maybe leaving a tooth fragment behind, or food getting packed into the empty socket if the packing fails. And another thing to remember after an extraction is that the nearby teeth tend to drift into the space that's mesial drift, and the opposing tooth can over-erupt, super-eruption. So regular follow-up dentistry is absolutely essential to manage that.
So, reflecting on everything we've covered, what's the single biggest, perhaps most surprising takeaway for our listeners?
I think the biggest takeaway is just the sheer prevalence, combined with how often it's missed. The fact that half of all horses, maybe more in older ones, could have this, yet it remains so profoundly underdiagnosed.
Ah,
That's the key point. It's not usually because we lack ways to diagnose or treat it. It's because those early signs are subtle, easily overlooked, and maybe routine, thorough dental care isn't always given the priority it deserves. It's this silent epidemic, really. It just highlights how vital that consistent, proactive dental care truly is.
wow, what a deep dive that was. We've really covered the gamut from the unique equine teeth that set the stage for this, through the detective work of diagnosis, including advanced imaging and the whole range of treatments, from simple cleaning to extractions, and emphasizing that critical role of diet and, most importantly, consistent preventive care.
Yeah, it really hammers home that for horses, just like us, dental health isn't separate. It affects everything: their ability to eat comfortably, to maintain condition, even their behavior and temperament. It's all connected.
So, the next time you're thinking about your horse's health, maybe remember this. The real puzzle with equine periodontal disease isn't usually the what or the how of fixing it, but recognizing it early. Given how common it is and how treatable it can be with early detection, why does it remain such a frequently underdiagnosed issue affecting so many horses in silence? That's definitely something to chew on. And that's it for this deep dive. We really hope you feel much more informed and empowered to advocate for the oral health of the horses in your life. Thanks so much for listening.